Eating disorder is a complex mental health issue. People worldwide. This disorder is characterized by unhealthy relationships with food, their body image, self-perception. I was going to say perspective, but because there is a perspective of how you should look. And I did a show about reality is not reality.
Okay, let's go.
Hello to all of you that took the time to listen or watch Coaching to Change podcast. Thank you so much for being here. I appreciate it. My name is Dr. Aaron P. Bryant. I am a master coach, developmental health, mental health coach. And I do this because there's a purpose that is available to all of us. And some of us find it, some of us don't. But I think this is my purpose. On this episode, we're going to discuss eating disorders. Now, everybody who has followed and watched my show, and if you haven't followed or subscribed, please do that. There is a subscribe button on YouTube that's available to you. Please click that. Every week we get new shows. So if you want to get notified, click the bell. And also my Instagram page. My Instagram page is available to you. And if you are not familiar, we have a Mastery in Life page that's also available to you that's going to provide a lot of details on a lot of the things that we talk about on this show. On that note, eating disorders is something that we're going to talk about today, because if I have clients who are struggling with any particular type of thing in their life, it's difficult for me to be able to communicate with them and give them the support that they need. Because if they have something that they're challenged with, that challenge is going to cause distractions. So we talk about these things. These are common things that tie into mental health, which is what I'm an expert in, because the awareness of that particular topic, basically the years and years of supporting people in this area, and then there's all the data and the research and the education that I've underwent. You put all that together and we kind of go back and circle back and talk about this to help other people. So eating disorders is one of the topics today. And if there's something you're familiar with, or your friend or relative, I hope that I can provide you some insight and guidance. This information is going to be things that will give you some perspective, and then also give you some things for you to do to help and support your friend, because it is not something that's healthy. My job as a coach is to give you the ability to improve your performance, accomplish what you set out to achieve, and that's exactly why we have to identify these particular roadblocks. So I'm confident that if you haven't already learned about Mastery in Life, that is specifically why we do this channel, because changing the way we coach, giving you the power back, is how we're going to catapult into your success. Again, subscribe, because you're going to get a lot of information. This particular topic is something that millions of people suffer from. Eating disorder is a complex mental health issue. People worldwide. This disorder is characterized by unhealthy relationships with food, their body image, self-perception. I was going to say perspective, but because there is a perspective of how you should look. And I did a show about reality is not reality. So that's why it's in my head of a perspective, because we have a certain perspective of how somebody should look because of what we see on reality shows. That's why I said perspective. But self-perception is also something that causes this, and often leading to severe physical and psychological consequences. These are the important things we're going to talk about, and despite their prevalence, eating disorders is often misunderstood. It is sometimes stigmatized, and worse, and probably the worst factor of it is it's not always reported, and that's what's scary. When it's not reported, if the person doesn't let anybody know, then it becomes a dangerous situation. Let's kind of understand what it is, because maybe you don't even realize, and you may have somebody that's around you that is suffering from this, or maybe you're doing it and you don't even know why you're doing it. Let's talk about how this particular mental health illness can cause severe disruptions, and that eating behavior, your attitude, and how it can impact even your emotions. It's not about food or weight. Everybody just think, oh, it's just the food you eat, or you're gagging yourself and all that. It's related to your physical looks and all that. No, it's deeply rooted in psychological concerns that's beyond just food. It frequently coexists with other mental health conditions. It coexists with the topics I've talked about many times, such as depression, anxiety. And here's a new word I have not mentioned, which is obsessive compulsive disorder, OCD. It ties into that. Again, a mental health concern. The most frequent types of eating disorder. There's quite a bit. We have anorexia, we have bulimia, you have nervoso, you have compulsive overeating. I try to get away from the clinical words. I meant to do that. More specified feeding and other eating disorders, but I mean, the point is that these things all tie back to having an unhealthy habit. I don't want to go too much into it like anorexia, because that is what most people are familiar with. We get into more of a psychological area, and I know my show borders the line a little bit, but it's important to mention it's a severe body image distortion that somebody may feel, an acute anxiety of gaining weight and food restriction. The individual will often see themselves being that way, and even though they see themselves overweight, they're actually underweight. It could result to extreme weight loss, malnutrition, and that in itself can cause a lot of serious health problems. I can go into that real quickly with heart disease, bone density loss, and really sad, you could also have organ failure. So we don't want to get into, we don't want these things to happen, because most people don't even realize how that would impact them. You think you're overweight, but you're not overweight, and it really bothers me with these perceptions of how somebody should look. One of the other things is bulimia. So that is bulimia. Sorry, I keep saying bulimia. Bulimia, that's a cycle of binge eating, and that is never a good thing. You turn around, you do this, you eat, and then you purge all the activities like vomiting, everything that you've done, the strenuous exercise, or you're taking laxatives. To prevent weight gain is your goal, but you do it in a way that could be hazardous to your health. It's not like anorexia, because an individual with bulimia, they maintain a normal weight, but they make the disorder less noticeable because they think it's less dangerous. Bulimia can result in a lot of electrolytes imbalances. Your gastrointestinal, that could be a victim to this. You could definitely get some issues in that area. I'm not a dentist, but I've understood that in my research, they can definitely cause some dental problems if you have the repeating vomiting on a regular basis. I'm actually going to ask my dentist about that. That one's something I was not aware of. I'm curious to understand how that works specifically, because if I was to say I have a client who's doing that, what if they brush their teeth after they're done? So I have to ask that question. What about binge eating? That is where you basically have a reoccurrent episode of eating large quantities, and then much eating is in a short amount of time, typically accompanied by feeling like your lack of control, the guilt, the shame. It's not like bulimia. Individuals are binge eating in disorder, and then they do not eat. This is where you don't purge the behavior. What we're talking about leads to obesity, leads to type 2 diabetes, cardiovascular disease, and there's like a series of other weight related health issues. And I mentioned There's this thing called OSFED. It's like other specified feeding and eating disorders. There's a series of them. You think you get the point. I don't want to gross you out, but I'm pretty sure you get the point. Causes of eating disorders. One of the factors that influences this is the complex interplay of genetic, biological, psychological, and socio-cultural factors. And I hate to say it, but I think we're seeing more and more of the socio-cultural factor more than anything. But for prevention and treatment to be effective, it is imperative to comprehend these things. And again, I'm looking at the social part. But let's be fair. Let's look at genetic and biological factors. Let's try to go through each step and each area without being too biased. On the genetic side, the genetics have a big influence on eating disorders. There's people with family backgrounds of eating disorders. There's mental health conditions related to families at increased risk. Biological factors such as irregularities in the brain chemistry, the hormones, the neurotransmitters. This is all can contribute to the development of this disorder. So this is something that I would say it might be more challenging to control and manage. Definitely going to have to seek some medical assistance on this, because again, it's almost like being I did a show on dependency, substance abuse dependencies, and if you are a child born to a mother who was using, say, cocaine or crack or whatever, you're kind of already in that bed without even understanding. A psychological factor that is more common than a lot. So low self-esteem, perfectionism, trying to always look your best. But that could be related to a history of trauma or abuse. If somebody's constantly telling you you're fat, you're fat, you're fat, you're fat, that could definitely be associated with eating disorders. Many individuals with eating disorders, they struggle with this feeling of being inadequate. The desire for control or distorted self-image. This disorder often serves as a coping mechanism. Choosing to do that and trying to lose weight is you're dealing with the emotional pain. You're dealing with the stress. You're dealing with the self of powerlessness. There's also factors that are related to peer pressure, or maybe your own personal purpose of trying to overachieve. You want to make a weight class in a weight division, or you want to make the cheerleading squad and you're a little too big and you really want to be I know this day and age has gotten a lot better where big girls are also cheerleaders, but again, that may not be your choice. We tie into the social cultural factor, especially in the Western societies. It plays a significant role in eating disorders. I talked about this when I did the show on reality is not reality, and how we perceive what we see on reality shows and TV. What we see is celebrities and how they look, the thinness, the beauty, the body image is perpetuated by the media, perpetuated by the fashion industry, social media platform. I can literally not look at my Instagram page and not see all of these very attractive women wearing all these different types of clothes or lack of, and that's what is interesting enough, is what's getting all the hits. And the more success they have, the more money they're making, the more of those videos are coming out. That perceives to be the way to make money. These societal pressures create an environment where individuals, particularly women, let's be honest, feel compelled to conform to unrealistic and unhealthy standards of beauty. Because I don't say that to be judgmental, but let's look at that. Men don't lose weight to comply to the pressure of looking handsome. They need to gain weight and muscle. It's going to be particularly women, and that's just the reality of it. So peer pressure, family dynamics, life transitions are all examples of dealing with your environment. That could play a role in eating disorders. For example, people who are raised, say, in a household and they place a high value on appearance. Diet might be a higher risk of developing disorder because you are being stressed because you don't look like your sibling. Your sibling could be thin, and one took one gene from one parent, one took another gene from another parent, and you got this. Why do you don't look like your sibling? So stressful life circumstances such as losing a loved one, getting a divorce, starting a new job. I've seen it work both ways, where you give up or you get focused. But if you get too focused, then you might find yourself with an eating disorder. Starting a new job, that can trigger an onset or exacerbation of eating disorders. These things are all based on these external situations that's going to impact you and how you process them. But from a trauma perspective, again, this is what I'm passionate about. This is where you are a victim to something and it's impacting you to do this. So I'm looking at things such as childhood abuse. That is linked to eating disorder because it could be physical, emotional, or sexual. Victims often develop these disorders because it's a coping mechanism. They're trying to regain control of their lives, or they just give up. There's neglect, the emotional and physical neglect that happens because of all the lasting scars in their life. The absence of care, the absence of attention that can lead the individual to seek comfort, and controlling, the food intake. That can lead to disorder. Bullying. Especially if your body weight or size is a certain component that plays a factor in the bullying, that can lead to some sort of disorder. I mean, that's a trauma trigger, and that constant criticism and shaming can push an individual towards unhealthy eating habits, and that could change their appearance. Interesting enough, my client I have now, he was actually discussing something related to that about not wanting to bring attention to her. It was something related, and she didn't specify. We haven't identified that she was going to do this, but that could definitely be a decision and a choice to start eating and create an obesity because she doesn't want to look attractive anymore, to bring attention to her because of the trauma she experienced. Loss of a loved one, domestic violence. Constant threat and fear can result in disorder eating as a means to regain a sense of safety and control. These are all things that are trauma related, which is important to me, and that trauma can definitely lead and disrupts the brain's ability to process emotions. It leads to a heightened sense of vulnerability and loss of control. This emotional turmoil that a person can go through will often drive individuals to seek solace. That's what eating could give them. For instance, a trauma survivor may engage in a binge eating situation as a way to numb their memories. And when I say this, it's almost like I'm saying the thing related to controlled substance. It's just an alternative. It's an alternative. Restricting food intake is a form of self-punishment, or eating too much food is a form of self-punishment. Trauma can cause lasting damage, and we have to identify that individuals' self-esteem and their body image. Victims feel disconnected from their bodies, leading to a distorted perception from their physical appearance, and that fuels the desire to control food intake obsessively. Trauma it has no limits. It crosses all planes, which is why it's so important to understand how mental health impacts people. Intersection of trauma and eating disorders can cause victims to endure it can hurt their mental health. The constant battle with food and body image exacerbates the feelings, the physical health deterioration from the trauma-inducing food disorders, or likely that they'll experience more physical health issues. I already talked about that, and that's going to just weaken the immune system, which means if they weaken the immune system, they don't have the ability to fight off any incoming conditions. Then you also have social isolation, and we talked about that before. Social isolation, what does that do? It's going to create a domino effect in depression. Going to create a domino effect into other different areas. But that guilt that comes from the trauma and the eating disorder was going to push them into social withdrawal. It just isolates them to avoid judgment. They don't want to be triggered by the situation. you're just going to worsen their mental health. And then there's another factor you can think of, I can think of, is also you have this difficulty trusting people. That can severely impact a person's ability to trust another person, making it challenging to seek help and build supportive relationships. This lack of trust can definitely hinder recovery, and that will prolong the cycle of disorder eating. And that is not what we want. It's definitely important for us to remember that and keep that in mind when you're seeing somebody who might be having a fluctuation of their weight. We need to investigate. The consequences are far-reaching, affecting physical health, mental health, and social relationships. This disorder can have devastating effects on individuals and their loved ones. And the sad part about it is if we don't address it, if we don't treat it, it could be life-threatening. It really could. The malnutrition and starvation in itself, the cases of anorexia, severe food restriction, can you imagine how that's going to affect your organs of your body? How that could be life-threatening complications? The cardiovascular issues alone, the eating disorders, the heart problems, the irregular heartbeat, low blood pressure, the heart failure, your gastrointestinal issues that you're going to have because of the vomiting all the time, the bulimia that can lead to all kinds of tears in your stomach. I mean, I'm starting to get clinical, medical, and I want to avoid that, but I think you get the point. I think you get the point. But it is a dangerous situation that can cause a domino effect of the body. I don't want to go into it too much, but with stomach ruptures, sore throats, bone density issues, imbalances of electrolytes, all of this stuff is just the outcome of what this can cause. And that's just the physical. The psychological is the depression, the anxiety, the obsessive compulsive behavior, isolating. And here's something that most people do not want to talk about, but I have never been afraid to say this. And somebody told me once on my, I don't remember the specifics, but when I was doing, I think it was a Dr. Bryant Speaks, or it might have been Field Talk, but I did a show on suicide. And somebody says, oh, we can't talk about that. It's not a topic we can cover. But the thing is, this is relevant. And suicidal thoughts and behaviors is going to definitely be a situation we have to be aware of. Individuals with eating disorders are very likely to consider to commit suicide attempts due to the overwhelming psychological distress that they experience. Because it relates to what? It relates to so many different elements, such as social, the family conflict, work and school disruptions, impact on personal relationships. Can you imagine the compoundness of all of this? This is the misunderstandings, the tensions, the lack of being able to perform, the inability to concentrate. You can't attend school or work. You're just feeling lonely. You're feeling isolated. It's just an ongoing thing, and we have to focus on treatment and recovery. I want to talk about that because I think you get the point. If you're listening and this is something that you are struggling with or know somebody, I think I've beat it up enough to understand the importance. What do we do? Let's talk about, because if we can get through treatment, we can definitely find recovery and appropriate treatment and support, because it definitely is not going to be simple. It's going to be a multidisciplinary approach. We got to address it, and we got to address all three factors of physical, psychological, and social. So there's going to be the medical. That's the nutritional rehabilitation. You got to restore your healthy weight. We got to find you a balanced, nutritious diet. So that's going to be one of the first steps. Dietitian, nutritionist, consult with patients to be able to develop a meal plan, to be able to build that up, because that's going to be important. You may have to require medication. Again, I talked about in cases of medication is specifically used temporarily to achieve the long-term results. If you're depressed, you may need antidepressants. You may need anti-anxiety. You may even need antipsychotic medication because of the severity. But if we can do that on short term, we can be able to achieve so much more long term. Because if we can get you to the point where you can process what we need to do to get you to recover, now we're being able to tap into the psychological part of this. That's when we can tap into understanding how do we focus on building skills in emotional regulation, how we distress tolerance, interpersonal effectiveness. That's when we start looking at those things and be able to help you. That's psychotherapy. I don't want to again get into that point to detail, but there is a cognitive behavioral component to this. But what about family? Family in the treatment process is going to be huge. Helping that person with their loved ones around them is going to be key and critical. And that's going to help them address any dysfunctional dynamics. And then we're going to lead into the support and the aftercare, because it's not something that's going to happen overnight. This is a long-term recovery. So you're going to need support groups, either online or in person. Foster a sense of community, understanding that you're not alone, and understanding individuals will be supporting you throughout the recovery. We want to avoid relapse. We want to create an intervention that's going to not allow you to relapse, but become successful. You're going to possibly need a therapist, a coach, somebody that helps understand and recognize the triggers and cope with the setbacks. And because it's not going to be short term, you're going to need continued assistance on this. After initial recovery, you're going to maintain the progress, and you're going to address new challenges. So if you're somebody who knows somebody who's suffering from this, be ready for this is a marathon. It's definitely not a sprint, because the treatment that's going to be needed for this, remember, we're talking about a trauma-related situation. So if it's trauma-related, these therapies help victims process that. The support groups, the nutritional counseling, and again, the holistic options such as yoga and all those other things. These are all things that we can utilize and to help somebody with this disorder. But if we can try to prevent it in the first place, that would be pretty good, because addressing the risk factors from the get-go and promoting healthy attitudes towards food, body image, and self-esteem, we won't even have to go there, because education is key. Preventing it is key. Schools and parents and healthcare providers, we need to start announcing that. Let's start focusing on what's real around us instead of focusing on these models that we see on all the different media channels and thinking that's what we should be looking like. We're setting a standard that's not realistic. Yes, do we need to be healthy? Yes, do we need to exercise? Cardiovascular exercising and all that is definitely important. But I got my best friend has always been a thick guy, big guy. You would say, people would look at him, they might even say he's fat. But he is not by no means overweight. His blood pressure, everything about him has been always on key. There's nothing wrong. And it blows my mind. Are you kidding me? How is it that you're like 5'7", 5'8", and you're almost like you're I don't know, he's 260 or whatever, but it's a lot of mass. It's bone density, it's mass. He's not fat. It's just the solid individual that looks like he might be. Most people will assume he is, but that's not the case. He's very healthy. Say that because, again, we have to stop assuming just because somebody might be whiter than another person that they're overweight. You have to be proud of who you are and accept it based on a medical. If your blood pressure, if all of your key components are green, checking the boxes, then you're good. Stop trying to overdo it. Building resilience, understanding your preventive measures, encouraging self-compassion. establish some coping skills, a sense of purpose. These are things that you gotta resist those social pressures and cultivate a positive connection about yourself. I want to wrap this up because I feel like I'm beating just kind of going in circles here because it's such an important topic, but I keep repeating myself about the topic. But what I want you to understand is that damage itself is going to be a difficult thing to get back, because when you start damaging the organs, you only have so many. Your body may have two of some, but one of others. When you create some deterioration in your organs, it's going to be a tough thing for you to be able to recover. Try to avoid getting to that point. The education, the advocacy, everything is necessary by fostering a culture of acceptance of who you are. Be aware of who you are and be proud of who you are. That is what's important. You may not ever look like that person you might see on Instagram or TikTok. Your body is your body, and it comes from a genetic makeup of your family. So it may not always look like the person who has a genetic makeup of somebody else. Your goals of what you want to set relating to yourself needs to be goals that's realistic and be acceptable of that. Be healthy under the conditions of what your doctor may specify. Yes, do you need to lose some body fat? Yes, you may need to lose a little bit of this. Yes, you may need to gain a little bit of this. Check your vitamin D, check your vitamin B. These are all things that are available to you when you take your physical, but don't overdo it. If you are checking all the boxes by remaining healthy, then you accept that. But if you are finding areas of your body that is causing some concern, then you target that within reason. Not because you admire a person who is on some sort of TV show and you feel like that's how you should look because of all the attention that person is getting. All right. I say all that with the support of, as a coach, you can achieve anything you want and achieve within reason. Please, I'm thankful that you took the time to hear the show. I'm thankful that you took the time to listen. And if you know anybody that's falling in this situation, please reach out to them. If it's yourself, do the necessities that's necessary for you to do. Do all the necessities. Do everything that I talked about to help yourself recover. If you need to reach out to me, I'm here. But most importantly, look to your left, look to your right. We call it flanks in the military, and be able to find those people who care about you and seek help. Communicate. Speak up. Contact somebody, because as I say after the end of all my shows, somebody is always listening, and that person is not always just me. My name is Dr. Bryant. This is Coaching to Change podcast. Thank you for listening. Hope to talk to you again. Take care.